Hello, this is Dr. Joe Adragna, Montrose County Medical Advisor to the Public Health Director, with another Montrose County COVID-19 update for April 13th, 2021. Thanks for joining us. Let's get started. First, I want to tell you that Montrose County has gone level green according to CDPHE's dial, and I want to touch on the impacts this has on mask mandates and capacity restrictions. First off, you can find more information by going to montrosecountyjic.com, where you'll find a press release that goes into detail on these changes. But specifically, with support from the Montrose County Medical Response Team, the Emergency Operations Center, and our Board of Health, our Public Health Director waived the mask, or otherwise known as a face covering mandate, that is ordered by state public health order. Now, the waiver is limited by existing state public health order, and face coverings are still required in some settings. And remember, private businesses may still require face coverings, and we ask you to respect those businesses if they require a face covering. So those places that cannot exempt face mask use includes preschool through grade 12 schools, public areas of state government facilities, congregate care facilities, including nursing facilities, prisons, jails, medical offices, including your doctor's office, personal services, and limited healthcare settings. Again, for more information, go to montrosecountyjic.com. Now on to capacity restrictions. Any business may operate without restriction on their capacities as long as they can endorse a 6-foot distancing rule, except for the following businesses and activities which may operate at only 50% of their pre-pandemic capacity according to current state public health order, not to exceed 500 people. Those include bars, smoking lounges, unseated indoor events, organized indoor rec, youth, or adult league sports, and indoor children's day camps, residential camps, youth sports day camps, and exempt single-skill building youth camps. Remember, those places and activities are limited to 50% capacity, but all the other businesses and activities that don't fall into that may operate at full operations without capacity restrictions, but should still request the 6-foot distancing. Also, seated indoor events may seat up to 10 people together, including non-household members, but if you want to do an indoor event with more than 500 people, the state requires that you contact the Colorado Department of Public Health and Environment. Let's talk about prevention for a moment, and specifically vaccines. First off, I'd encourage you to get the vaccine unless you have contraindications, such as anaphylactic reactions. This protects yourself, your family, and your community. And it's one of the reasons why Montrose is doing so good with the pandemic statistics at this point, which we're going to go into in a moment. Who's eligible for the vaccine? Well, we're currently in what the state calls phase 2, and that means anyone ages 16 and over without a contraindication can get the vaccine. Now, in Montrose County Public Health is offering Moderna and Janssen, which is only approved for people 18 and older. Pfizer vaccine is approved as young as age 16. This Saturday, we are holding another vaccine clinic at Friendship Hall. That's April 17th, and it is going to include not only Johnson & Johnson's COVID-19 vaccine, but also Moderna. So we're going to be doing about 1,000 doses, and there's going to be a combination of booster doses being given out at that clinic and primary doses or first doses for both Moderna and Johnson & Johnson. If you would like to make your very own appointment and book your slot to get a vaccine, go ahead and go to montrosecountyjic.com/vaccination, and there you'll see this screenshot and you can click and make an appointment. If you're watching this online, that is not a live button, but please go to montrosecountyjic.com and there you will find the actual appointment registration button. If you don't want to use the computer to register, go ahead and give us a call at 970-252-4545 and press option 1. Again, 970-252-4545, and that will get you over to Public Health and we'll get you scheduled. Again, that clinic is this Saturday. That's the only clinic that we're holding this week from Public Health, and we're doing about 1,000 vaccines. If Saturday doesn't work for you, no problem. We have many other providers within Montrose County, including Basin Clinic, City Market, Genoa Pharmacy, Peak Family Medicine, Walmart, Walgreens, Safeway, River Valley, and Pick Place. You can contact any of those places to see if you can get a vaccine from them on a schedule that is more convenient for you if this Saturday does not work for you. So how are we doing vaccine-wise across the country? This data on top is from CDC and is updated as of April 12th. This shows that nearly 190 administered doses of COVID-19 vaccine have been completed and 238 million delivered doses. Of those 189.6 or nearly 190 million administered doses, nearly 121 million have gone to people with at least one dose, and another 74 million are fully vaccinated. When we look at those who have been fully vaccinated, that's 22% of our total U.S. population, and 36% of our U.S. population has received at least one dose. These are really good numbers, and if you've been waiting to see how other people are doing with the vaccine, you have 190 million administered doses and 121 million people that have gotten at least one dose. So by this point, most people know somebody who has already received the vaccine. Of those that have received the vaccine, we still continue to target those that are in our highest risk populations across the country, although Colorado is open to anybody. So when we look at who has received at least one dose, 43 million of those folks have been ages 65 or older, and 119 million, of course, are over age 18. So that tells us that just over about 1 million people have been less than 18 years of age and have received the vaccine, so probably looking more at the Pfizer vaccine for that group. When we look to the state specifically, we see 1,278 enrolled providers to administer the vaccine. And when we look at all the efforts that they've done, 2.1 million Coloradans have received at least one dose, with nearly 1.3 million Coloradans fully immunized. And I think that's really astounding for a state population of around 5 to 6 million people. So when I look at this, it gives me a lot of confidence in this vaccine, because 189 million doses administered, that's a lot of data that we can learn about the safety and efficacy of this vaccine. And I think it's showing why we are having such a turnaround in this virus, this pandemic. And specifically, Montrose, I think, is benefiting tremendously from those of you who have gotten the vaccine. And we'll look at that in just a moment why. When we look statewide on the vaccines that have been administered, we're seeing Pfizer, Moderna, and Janssen. Pfizer is in that blue color, Moderna is in red, and Janssen is in green. So we see Janssen makes up the least amount of the three different types, but has grown in popularity as a single dose option, whereas Pfizer and Moderna each require the 2 doses. Now, when we look at just our west region, that's Montrose, Delta, Gunnison, San Miguel, Ouray, and Hinsdale, we see that Montrose has given about 24,000 doses, and as of this date, April 12th, 23,574 have been recorded for Montrose County residents, and that leads the region in the total number of vaccines, but of course our population size is also larger. We look to our partners in Delta and Gunnison. They're doing a great job with 17,000 in Delta, almost 14,000 administered in Gunnison, and so on. When we look at the age demographics, we still see that the 60 plus leads in the total percentage of administered vaccines, and women still predominate in the gender of vaccine recipients. When we look at Montrose County's vaccine distribution, so that's how many vaccines we've received as a percent of state population, it's been dwindling down closer and closer to 0.000, currently at 0.02, and that's because we have been getting smaller and smaller shipments over time to kind of get us more in line with our representation of our state population. Now let's look at the COVID status and see where we're at. So this is statewide overall county status according to CDPHE's dial. Remember, CDPHE is state public health. So Montrose moved to level green, as you learned last week after our presentation went live. The following day, the state dial updated for Montrose County because our our metric information had improved to the level where we met their requirements. So Montrose is shown in green here, along with Delta, Ouray, Gunnison, San Miguel, and Mesa blue, and there really has not been much change from last week's report overall. Now, when we look at the 1-week cumulative incidence by county, we see that Montrose is in the green, along with Ouray and San Miguel, Dolores, San Juan, and Hinsdale. We see that Mesa County, Delta, and Gunnison are in the blue with slightly higher 1-week cumulative incidence rates, and we hope that that starts to turn around for them. When we look at 1-week average positivity by county, Montrose is also looking very good here with very low % positivity in those tests that are being done. Mesa County is in the blue, Delta, Montrose, Gunnison, Ouray in the green. Now, when we look at number of days with decreasing or stable hospital admissions, we see that Montrose is showing a sufficient hospital capacity without significant strain on our healthcare system. And we see that there has been some shifts in this graph when we look to the Front Range and the central aspect of the state. They have been showing increasing demand on their hospitals, not necessarily put them at risk, but changes from last week in that they have recorded more admissions since last week. So let's look at the dial metrics. There's 3 of them. There's 1 week cumulative incidence, there's 1 week average positivity, and there's declining or stable hospitalizations in Montrose. As of last week, our 1 week cumulative incidence was 30.4, and of this week, it's the exact same, 30.4, so no change. Now, if you're following it on a daily basis, there have been ups and downs throughout the week, but 30.4 is where we ended up 1 week later. When we look at the percent positivity on test 1 week later, it went from 1.9% down to 1.0%, and we have remained at 14 days of declining or stable hospitalizations, which it changed to green in this metric on the right, but that's only because the dial as a whole moved to green. We have been showing 14 days of declining or stable hospitalizations in Montrose County for quite some time. So when we look at actual hospital demand related to COVID, this graph shows that. In black, you're seeing COVID positive and PUI, or persons under investigation census at Montrose Memorial Hospital. And we look to the right part of the graph, and we see that these figures here are very low. We see 0 currently, so that means 0 people are admitted in Montrose Hospital with COVID or suspected COVID. We had 2 days where we had 1 person, and then prior to that we had 1 person, and then it spiked up to 3, but very low numbers, generally 0 most of the time. In this gray line here, we show our 14-day cases per 100,000 population. When we look to this graph, what we're trying to show here is a model of COVID positive hospital demand, shown here in blue, against actual COVID hospitalization, shown here in yellow. And we see that the model predicts that we would be at 0 on our hospital census for confirmed COVID for the rest of the month. This model was updated on March 1st, and the graph was updated as of April 12th. Of course, with all models, they do have some limitations. These limitations specific to this risk is inclusive of variants not being considered, waning immunity as a potential, concentrated high-risk exposure, and a potential overestimate of the immune population, because we're possibly double counting some people who were naturally immune, whether they knew they had infection or not, and they got vaccinated, so they may have been double counted in the model. Overall, though, we think that that error rate would be quite small. When we look to multiple counties around Montrose, we see that some counties have increased in their 14-day case per 100,000 and some have gone down. What I've done here is I've shown you the counties: Delta, Montrose, Montezuma, Mesa, Gunnison, Uray, Summit, La Plata, Eagle, San Miguel, Pitkin, San Juan, and Garfield. And I've shown you week over week from February 15th to April 12th a 14-day cases per 100,000 population bar graph. And then in a line graph, I've shown you the 14-day cases most recently reported. So what we see here is that Delta County is up on its 14-day cases per 100,000 population compared to last week, so it's shown in red. Same thing for Montezuma, Mesa County, and La Plata, and San Miguel. All other counties are either flat or down from last week's report of 14-day cases per 100,000 population. Remember, this is a per 100,000 population, so this will tell you prevalence within the community of virus. So we would say that Montrose County has a smaller prevalence of COVID in the community than Delta, Montezuma, Mesa, Gunnison, a bit more than Uray, less than Summit, etc. Overall, when you add up the 14-day cases of each of these counties represented, it is slightly less than was reported last week. When we look to the West region, which is more narrowly defined by CDPHE as only including Delta, Gunnison, Montrose, San Miguel, Uray, and Hinsdale, and you may notice we did not look at Hinsdale on the last graph, we see that this region is growing in the number of cases. So how do we see that? What are we looking at here? The black line is our smoothing trend line. Well, what's it trying to smooth out? These gray dots are 3-day average daily incidence rates. And so when you smooth out the 3-day average incidence of cases, you get this black line. The bottom graph is trying to show you the daily change in the slope of that black line, the smoothing trend line. If this bottom graph is red, it means that your black line is going up. If the line on the bottom is green, it means your black line is going down. And so what this shows us is that we had a relatively rapid increase in cases in late March that then slowed early April, picked up a little bit of steam in the first week of April, and then have gone slightly down from that most recent peak, almost at 0.0000. What that would mean if it was at all zeros on this bottom graph, is that the black line above is holding stable, that we're not gaining more cases and we're not losing cases. We're just sitting at the same number every 3-day average, on a 3-day average. What we suspect will happen is that this will actually start to slow even more and go down. And I'll show you why I think that. But first, let's look at COVID variants. There's a fourth variant that I'm adding to the list here. We had B117, the UK variant, B1351, the South African variant, B1427/429, the California variant, and now we're adding P1, the Brazil variant. 4 counties in Colorado have now reported the P1 variant within their samples. That's Arapahoe, Boulder, Broomfield, and Denver. Now, Montrose County has had the UK variant in it. We reported this for the first time last week, with 1 case now reporting 4. The counties that have the South African variant, the number of counties has not changed now over the last 2 weeks. It's just 5: Chaffee, Moffat, Pueblo, Sedgwick, and Teller. So when we look at these variants, the question really is this a problem for us? Does this mean that our vaccines don't work? And this is a quote from the CDC, and you can look up more information by Googling about variants of the virus that causes COVID-19 CDC. And if you Google that, you'll be taken to their web link for that. But they say so far, studies suggest that antibodies generated through vaccination with currently authorized vaccines recognize these variants. This is being closely investigated and more studies are underway. What that's saying is, hey, we know these variants are a little bit different, but the vaccines still work. So if you're looking at the vaccines, you're saying, I don't know if I really want them because I'm not sure they're going to work. I think you should still get them. I think they'll still work. And just note, these were updated on 4/12, not on 4/5. Okay, so let's look at the statewide cases. This is on a 7-day average of COVID-19 cases in Colorado. We see that the state has been increasing in that 7-day average until just a couple of days ago, where we started to see it come back down. That's really good news, and that's one reason why I think our region will actually start to decelerate in the number of new cases and then go back into the negative trend line. When we look at the state as its own region, we see that its 3-day average daily incidence is now starting to decline. The slope of that smoothing trend line is in the negative. It peaked back here around April 7th and it's been coming down since. So when we look to the bottom graph, we can actually see that more easily. We crossed the 0 line around April 7th, April 8th, and have been negative since that time. That means that black line will come down, and with it, our 3-day average incidence will come down, and fewer cases will occur. Now, of course, this can change any day. So we're hoping for a trend that maintains in the negative, but it could also reverse and go positive. When we look at hospital demand, we see that statewide hospital demand, shown here in the bottom right graph, has been on the uptick. We see in this green graph, we see COVID confirmed persons, and in our yellow, we see persons under investigation. So we have had an increase in hospitalization statewide. Remember, Montrose County has been flat at 0. We had 2 days with 1 person, but we've had little cases here and there, little in terms of quantity, but has not grown or threatened the healthcare system here in Montrose since our peak in earlier part of the year. So when we look at acute care bed use in Colorado, we do see there's been a 1% increase on a 7-day average from last week's report to you, but very, very minor change. To me, that's not a trend. It's just reflecting expected ups and downs. When we look to ICU bed, they're up 1% as well, which is a slowing. Last week, they were up 2%. Again, minor variations likely expected from normal course of duty. So overall, COVID census going up, hospital bed use remains pretty stable when we look across the state. Now, when we look to the country, this graph is showing us cases reported from April 4th to April 10th on the CDC's website, obtained on April 12th. Now, this is not a per 100,000 population type of graph. It's simply showing you the number of cases reported in that week. And so we see that more metropolitan areas are going to show up in darker colors because they have higher numbers of cases. But Montrose is shown here with light green, and around us is a lot of light green. We do see that the Front Range has more cases. Of course, Arizona with Maricopa County, and down in Texas with Houston, some parts of Florida, and other highly populated areas continue to report cases. So I show this simply to show you that there still is COVID out there. There still are cases around the country. If you're going to an urban environment, maybe be more cautious, but more importantly, get your vaccine so you're protected. And this concludes our presentation for today. If you're watching us on YouTube, please smash that thumbs up button, subscribe, hit the notification bell. It would really help us out and make sure that other people who are interested in the same topics get this information. And we hope that you'll join us next week for our Montrose County COVID-19 update. Take care.